Welcome to the Rimm-PODCAST, episode 74. I'm your host, Iggy. Today, we got a really special guest that I've been waiting for years, doing in the podcast for the last 5 years. This is a very interesting guest. There will be a lot of discussions. About his campaigning. He's basically board certified neurosurgeon, attorney, educator. He teaches the people about the healthcare reforms in the law school. He's a neurosurgeon for the spinal and the brain, one of the best names out there. And I'm advocating, campaigning, and helping him out to get his name out. We have a lot of stuff to discuss. So I would love to. I usually introduce the guests, but I would love that he introduce himself.
So good afternoon. Thank you for letting me have me on your show. It's awesome to be here. My name is Dr. Nizam Razack. I'm a local neurosurgeon that's been practicing in the state of Florida for over 35 years. I'm also a law school professor. I teach healthcare law. I've lived here in the Orlando area, specifically in District 11, for over 26 years.
Perfect. So, doctor, I know we have been before the show, we have been discussing quite a few things that I want to jump into it. Because I've been in insurance, I've been in pharmaceutical reps, so we have a lot of relationship. I've interviewed many doctors, but this one is a specific, and especially because you can touch one of the two most credentials that you can, like being an attorney, being a medical doctor, and then almost 45 years in education alone and then you decide to run for a Congress. It's an interesting. So now, I want to jump into the healthcare. Because you are a professor in the healthcare. Being in insurance in this country, everything is so expensive. It's getting more and more, and a lot of business owners are closing business due to the insurance healthcare costs. Some of them seeing renewals, 45% increase over the last year or so. We are in a $5.1 trillion debt just alone in the healthcare industry alone. 3.1 to 3.5 billion dollar goes to the hospitals. 1.1 billion goes to the physicians, and the rest of the outpatient surgery and stuff. So that's almost, I would say, 20% of our GDP in healthcare. And now we are one of the wealthiest nation on the paper and with the money, but one of the unhealthiest nation when it comes down to the treating the patients. So if you become a congressman, which I rooting for, what you gonna specifically do this on expenses, and hospitals doesn't have the menu. You go to a restaurant, you know how much you're paying for. When you go to hospitals, you never know. Last year or the year before, there was a 40% of foreclosures in the United States due to the medical bills, and nobody pays attention to that. So people are losing house and left and right. Certain people getting rich and richer. Certain people getting. There's no more middle class. Middle class is disappearing. So if you become a congressman, what is the biggest reason healthcare has become so expensive, and who should be held accountable for it?
Well, the biggest reason healthcare has become so unaffordable is the increased bureaucracy that's occurred over the last 25 years. There's too many middlemen. There's been loss of the doctor-patient relationship. Now you have these large corporate hospitals, you have these large corporate insurance companies, and doctors are called providers. They're not called doctors anymore. Mm-hmm. And this layering of bureaucracy costs money. And to answer your question, as you mentioned, medical bills are the number one cause of personal bankruptcy in the United States.
Correct.
The other problem is there's a lack of price transparency. For example, if you come to a private doctor's office like myself and get a procedure, say it costs $400, like an MRI scan, hypothetically. Mm-hmm. If you go across the street to a hospital, that's like $4,000 or $5,000 for the same procedure, or the same, given everything equal, for the same quality. Mm-hmm. So that doesn't make common sense why there's such a large discrepancy in pricing, and patients don't know. So the first thing I would do and suggest is federal price transparency laws. Mm-hmm. Because if people knew what they were paying for, they wouldn't choose the more expensive thing, mm-hmm. all things being equal, if the quality mm-hmm. was equal, mm-hmm. especially if they knew it was the same doctor providing the same procedure. Mm-hmm. If you go to New York City or even here in Orlando, you can get a hip replacement by one hospital with the same doctor. At the other hospital across the street, it's like 4 times the bill. Again, price transparency. We need to know what we're getting. So if we know what we're paying for, and that's a federal law, prices will come down across state lines and certainly make healthcare more affordable. That's number one. Number two is all the fraud and abuse. There's $100 billion of Medicare, Medicaid fraud in this country, all right? And that's just the ones we discover. This doesn't include all insurances. There's probably like 1 trillion. Of that 5.4 trillion number you mentioned, 1 trillion is probably fraud and abuse. So, I mean, if we have a $35 trillion federal deficit, we can really do a lot of, bring that down significantly if we just stop fraud and abuse. So those are the two things to answer your question.
And I know healthcare insurance getting more and more expensive. So when you take that into account, that's an average of 15,500 per person just in a loan. So second thing is holistic medicine. There's a lot of prescription drugs that are prescribed by insurance company, give it to the pharmaceutical company prescribe directly to insurance company, and then you might find an alternative drug that costs 10 times less, but then that drug has become luxury rather than because it's not covered by insurance. So they are dominating, pharmaceutical industry dominating and overseeing the doctors, what they can do or not. There's a lot of incentivizing into that field that should be federally required more lawfully. Thirdly, then insurance are cutting ties with pharmaceutical companies and lobbyists to putting a debt on everything comes from the kindly taxpayers' dollars. However, I want to mention transparency. Many doctors or hospitals cannot do that with Medicare. Medicare set the prices, right?
Yes.
And they said for these particular procedures, this is what should we pay you. This is what the market is paying you. But when they go to market, they can charge whatever they want to charge. So if you become a congressman, what is the specific thing you're going to do? I know it's a transparency. Second thing, you are a congressman, a great congressman with a doctor medical degree, a lawyer who should teach. How do you going to help? Because right now you go into sessions, right?
Yes.
You go to Congress sessions. So now, how do you going to bring your own colleagues from your own party, but also convince other colleagues from another party? Now, once that law passed and they vote, then you got to go to Senate. Senate got to go to Senate. So it's 3 layers before it becomes an effective law. So what are you going to do in that particular situation when it comes down to the, not just transparency, but being more disclosed with the public sector?
Yeah, so obviously Congress is made up of Republicans, Democrats, and independents. And Medicare and healthcare is a bipartisan issue, as you mentioned. So you have to be able to effectively communicate and work with people that, quite frankly, don't share your views.
Yeah.
And you have to be able to tell them, hey, Medicare needs to be reprioritized. Funding for Medicare has to be reprioritized. And that's the problem. People between the ages of 60 and 90, that's the largest demographic of our population in the next several years. So there will be more people in that age group. So to me, that age group has to be taken care of. And Medicare and things like Social Security, these are the people that built our country. They paid into the system. They paid taxes. They paid Social Security taxes. So our government has a contract with these people to make sure they get taken care of. So we have to find ways to reprioritize funds to make sure Medicare and Social Security are stabilized. And one of the best ways of doing that, as I said earlier, is stopping fraud and abuse.
Yes.
I just mentioned to you, there's $100 billion that we know about.
Yeah.
There's a lot more than that.
There's a lot more that we don't know about.
So the second thing is we have to stop sending money abroad. Our taxpayer money cannot go with blank checks to foreign nations. We have to be very strategic. Obviously, there are world disasters and there are humanitarian things that come up. But aside from that, we have to be truly America first and look at our seniors, the Medicare recipients, and make sure they're taken care of.
Yes. And I was just looking that we just recently reached out paying the $1 trillion in interest rates alone on our debt. That's a lot of money.
Yes, sir.
Yeah. So now, I want to move on because I know you are big in freedom health insurance. This is the really sensitive topic. I've been interviewing many people from board of directors, school boards, mayors. Everybody has a different opinion. Everybody has a different direction. So, should vaccine mandates ever return in America, or should medical decisions always remain between the patients and their doctors, rather than somebody has no medical degree and they're coming out with some because they have influence, they have the money, they're discussing what should be vaccine or not? What is your stance on that?
Well, first of all, let me give you my bias. I'm a conservative person. I'm a constitutionalist. So medical freedom is an important right. People have autonomy over their bodies.
Yes.
So my opinion is that any medical procedures that are performed are not done through government mandates. They're done through informed consent. And that what means that the doctor communicates with his patient and discusses the risks, the benefits, and alternatives, whether it's an injection, a vaccine, or whatever procedure that they need or are being recommended to do should be discussed between the doctor and the patient based on that informed consent principles. That's my opinion.
Okay. And then there's a lot of, like I said, I'm just taking it from experience. We all experienced COVID-19 shots. I like I said, I'm not against pro-vaccine, anti-vaxxer. I am for the transparency. However, there's many people being forced in our own counties. And then you said if you don't take, you're going to lose the job. However, after 4 or 5 years, our government just passed a law that there's no mandatory vaccination when you enter the school. So now I've been vaccinated at beginning to enroll in school. So I'm now asking my question logically, like, what is the reason? Like, are we getting discriminated? You know, everything about kind of discriminating, not discriminating, but I've been vaccinated and now we don't. So, like you said, we should. What is your stance on that? Like we forced, then we not forced, and politics. It's all about political game.
Yeah, I'm against governmental mandates for vaccines. We have to have scientific inquiry about this. We have to think about this logically and scientifically. As physicians, that's what we do. And that's where that informed consent comes in, where we have to discuss, okay, what are the risk factors? What are the bad things that could happen? Why are we giving this vaccine? What is the intent? I'm not anti-vaccine. I'm anti-government mandates. So vaccines work. We know that scientifically. Absolutely. But to give an infant who has a growing brain 100 vaccines at once, that doesn't make scientific sense. So we have to look scientifically at how to stage these things, what is the best for our population and the health of our country. And unfortunately, COVID, there was no time to discuss these issues, obviously. And so our bureaucratic leaders thought it best to have a governmental mandate. But governmental mandates don't do well over time for our population.
And like I said, now you have, for example, we have a Seminole County. The board of directors, school board, they might say, well, we're not pushing at all. Then you go to the Orange County, for example. I'm just taking for an example. It happens to all over the place. Now they're pushing. So now I live in the Seminole but work in Orange, and I'm lost. As a citizen, I'm lost because there's no transparency. Because it seems like they're just playing and infiltrating that, meaning who's going to become a soundbite, who's going to become a better, who's going to be more influence, while they are destroying their own citizens within their own counties. So if there isn't a law mandates, and this is an emergency, it should be applied all over the place. A governor might say no, a local leader say yes. And like you said, there's no transparency. So for the people who listen to podcasts, and rather, they're kind of lost. It's like, what the heck is going on?
This is why politicians shouldn't legislate healthcare decisions between doctors and patients. That's the problem. That's why I'm against government mandates, because there are exceptions to every rule. Every patient is different, and only a physician would know that. So the decision should be based on the physician's experience with his patient, or pediatrician's experience with that child and their parents. That's where the decision should be made, not in a bureaucracy or made by a public servant that is trying to perform a service by mandating healthcare law or public policy without understanding the science behind it.
Like I said, this is a great topic, so I want to discover this. Now, I know you get you own your own business. You're getting to the Congress. It's God bless to you because there's a lot of work between your being a professor, being a neurosurgeon, and running for a Congress campaign is a huge thing. Now this is the third hottest topic. Do you support banning members of the Congress and their families from trading individual stocks while in office? I see every damn politician that enters in, he comes broke and then he exits out multimillionaire. And on the $220,000, $180,000 salary, there's no way in 20, 30 years you can have $100 million. So if you become a congressman, what are you going to do about that?
Yeah, I'm all in favor of having a federal congressional stock trading ban, and their families for that matter. Again, it's considered insider trading. As a congressman or elected governmental official, you have privileged information. You cannot violate your oath as a public servant to your citizens by making money off your position and knowledge of the stock market. So I'm 100% for a permanent ban on congressional stock trading and their immediate families and their administrative office personnel for that matter. Because if I did it, it's considered insider trading, and we get put in jail.
Yeah, we do.
So why are the rules different for our elected officials? Should they have a higher scrutiny?
Yeah, they should. They should.
That's my opinion.
It's such a great thing. I know we have touched a little bit on corporation, how much they have an influence on the hospitals and doctors, and like I said, there are certain hospitals in 2008, one of the biggest hospitals, they purchased all of the doctors around them, and they put the doctor out of the industry over the night, basically. So, but if you become a congressman, should a large corporation be allowed to keep buying thousands of single-family homes while young families struggle to buy their first houses? House affordability has become a nightmare.
Yeah,
the state of Florida is through the roof. We've been giving them hundreds of thousands of dollars incentives to these big non-institutional creditors like the Freddie Mac and all of these big companies. Instead of $20,000-$50,000 credits, why we don't give it to the homeowners? Give it to them directly, incentivize them rather than corporations.
You're quite correct. I mean, that's why Congress passed that recent law a couple of weeks ago, where it bans large corporations from buying more than 350 homes at a time. I don't think they should buy any homes. Zero, in my opinion.
Yeah.
So I think they were lenient with large corporations, but obviously when large corporations buy homes, it raises all the prices for people like you and me.
Yeah.
The other thing, as you mentioned, the second thing we can do is we have to modify our tax code. There have not been any changes in the IRS tax code for decades over this issue. People like first-time home buyers have to be given tax credits, so they're incentivized to purchase homes. So it could be something like 15 to anywhere to 50,000, depending on where they live. I think those sorts of things could be done to incentivize home buying, because we're about 4 or 5 million homes short. We have a deficit of 4 or 5 million homes in the United States. There has been a lack of home building since the last depression, which was in 2008, 2009. So over the last 20 years, we've been falling short of home building.
Yeah, and there's a lot of vacant. There's a lot of vacant properties too. The investors just holding up. They don't want to rent it out. They're just writing off the taxes. And that's like I said, we already have a lot of vacant houses. Why are we even destroying the nature? Why don't we allow it? But certain corporations just incentivize, just allow, this is my write-off. So they don't, for them renting out, it's no point of doing that. I want to now jump specifically into your Congressional District 11. That's a big district. It's connecting Lake County, Summer, and part of Orange County, right?
Yeah, it goes from the villages in Sumter County down to Leesburg, in Lake County to Claremont, all the way to Lake Buena Vista, which is Orange County, West Orange, and then to North Pope. So it's a very large district.
It's really like almost 850,000 people.
That's correct.
There, yeah. So I know we have a previous the Webster congressman who is retiring, moving away, stepping down because he reached his retirement point of view. Now we have like 5 candidates from Republican Party and a couple from the Democrats Party. Everybody in the Lake County, especially in that county that you're talking about, it's emerging huge development. and nature is beautiful. Preservation, we used to preserve a lot. Now developers comes in, and with the bureaucracy, they buy the votes. They put a lot of money into the campaigning of the certain leaders. Now they overdevelopment, and like you said, Lake County and that part of the area has been preserved for many years, and now many people feel that as a country. You want to live in Orlando, but you want to escape. You escape in the Lake County, Mount Dora villages that you want to escape. But now they're coming overwhelmed. Now, why is that becoming overwhelmed? Because Orange County itself, we have a lot of police officers and firefighters who actually live and work in that. But because of affordability in Orange County, they've been pushed back to live. So now these people need to go somewhere. If you become a congressman in the District 11, are you into banning future developments and occupy all unoccupied residents and bacon before you destroying or killing another tree? What is your stance on that?
Yeah, obviously, home building and developments have to be done with certain environmental protections under control. But the big problem now is infrastructure. We don't have enough roads. We don't have enough bridges. And the ones that we have are either too small and not available to handle the population. Because remember, after COVID, there are a few million people that migrated to Florida from the Northeast, and that's where the problem started. So these areas, not only did they boom and all the buildings started because of immigration from out of state people, it also had to do with the fact that homes, as you mentioned, are unaffordable within Orange County itself. So again, those two issues, but clearly, especially in Lake County, there are environmental concerns that we have to respect. But I think if we build a proper infrastructure, then we can protect the environment in the areas where they're thinking about building many large home sites, apartment complexes. Especially with the apartment complexes, they're going left and right all over Central Florida.
I know everybody talking about building the AI centers into, especially Lake County, Mount Dora. That's your district, and I did have some intensive research on it. How much water it requires, how much. Do you believe the AI companies should be legally responsible if their technology harms children and violates American privacy, especially after they build the AI centers in those districts? Because once you build the AI center, you collect all of the database. And I've been hearing that people can go miles and miles with the noise and using so much electricity, using so much evaporating the air and stuff. So what is your stance on that? If you become a congressman, are you going to ban these AI companies totally, or you say, listen, yes, you can do, but this is the curriculum you can propose?
Well, you mentioned two things. Number one was environmental. So obviously they use a lot of water. So these companies where they build these data centers, they do pollute the water. So they do, they affect the environment around which they're built. So obviously that has to be taken into consideration. Putting them in areas where there's residential developments and things, I'm against that. And these companies have to be environmentally protective where they build these centers. You can't put them in residential areas. That's one thing. The second issue you mentioned was children's protections. There is a federal law for children online privacy and protection. For kids under the age of 13 are legally protected. Their privacy is protected. But that's only 13. In my experience, most of the problem is between kids between the ages of 13 and 18. So we haven't made any federal laws or issues concerning that. Because AI, it can very easily replicate your voice,
manipulate
your image, so many things. So, and these kids' online data can be pirated. And as they go into society, this could be a big problem. In terms of copyright of imagery,
everything.
Name rights. There are all sorts of things where these kids, as they grow into adulthood, could have problems later in life. So absolutely, we need online privacy protections, especially for children's data. Not just 13 and under, I think 18 and under.
So, but because you are a doctor, there has been also a lot of safe concern regarding to the health. Because if you are exposed in the environment you are around, exposing to the pollution and air, because it's a big area. So what is it, as a doctor, you can discuss what are the health concerns if you put these big AI centers to the people around the neighborhoods? Or
obviously you have a contaminated water supply. And they, as you mentioned, they drain a lot of energy.
Mm-hmm.
So there's not only effects on our power grid and energy supply, but obviously our drinking water, the water, the environment, the soil. So that's why I'm against building these data centers in areas that are populated or have neighborhoods.
This is one of the probably. I want to go back again to this as a neurosurgeon. What is the one thing that you think the American healthcare system is getting completely wrong today? As I said, wealthiest nation with most advanced technology, most advanced entrepreneurs, initiatives, innovators, you name it. We are like the best of the best. But when it comes down to treat the people in the healthcare system, we are the worst of the worst.
Yes, my opinion is the number one beef problem I have with this system is that doctors should be making medical decisions, not hospital administrators, not insurance companies, not bureaucrats, not even our elected leaders, unless they're a physician like myself.
Of course, of course.
But this is the problem. You know, do you know as a lawyer, to own a law office, you have to have a law degree. You have to be a lawyer.
Yes.
Anybody can own a doctor's office. Anybody,
crazy.
any businessman, high school grad, whatever, can own a doctor's office. That's why there's so much fraud in the medical system. Because if only doctors owned physician offices, all this baloney that was going on with fraud and abuse, half of it would be gone. Now they have all these, and the other thing is the decision making. If you read your insurance, when you sign up with a health insurance company to provide a health insurance provider, look at the contract. Nobody reads the contract.
Nobody.
What the contract says is the insurance company decides your medical care, not your doctor.
That's
I mean, I asked for authorization from insurance companies. About 20 to 25%, sometimes 30%, I get denied to do the surgery. Why? Because the insurance company said so. And do you think it's a neurosurgeon that's telling me this? Absolutely not.
No. Now, like I said, we landed to the moon. We landed to any other nation and country, you name it. We explored everything we can explore. But what's so intensively and logically, in my mind, in many other minds, I just cannot overcome that we didn't found after all of these years that we didn't find a cure for a cancer, a cure for the cardiovascular disease, cure for a tumor, and cure for many other things. So my question, are we doing this intentionally or unintentionally? I know things behind, but what is your stance on as if you come in the Congress, are you going to push it like, wow, we should have? We spend billions of dollars on research. It's for me, logically, you spend that kind of money and you have a best of the best scientists, best of the doctors that you cannot come up with the cure of the cancer, and we can send the people to the moon. It's just
we will always have medical problems as we evolve as a society. I mean, no matter what genetics we have, we'll always have medical issues. And there's one reason. I discussed this, my opinion. About 70% of the health issues in this country is because of one reason. It's what we put in our mouth.
Yes.
It's because of our diet, it's our smoking, the use of tobacco, alcohol intake, what we consume. That's the number one reason that 70 to 80% of our healthcare costs is based on us. Until we invest more in prevention and as a society decide that we're going to allow places like McDonald's, Burger King, serve high levels of alcohol and drinks and abuse drugs, I mean, that's not going to change. There's disadvantages and advantages to a free society, and that's one of the disadvantages. And again, we will always need medical care as long as we decide that we're going to put unhealthy things in our mouths.
So, but the question, how do we going to do prevention when the pharmaceutical company and insurance companies owns everything? And now I am in the middle income family, man, barely surviving. And now I need to go do the CAT scan, or I need to do x-rays that cost thousands of dollars if I don't have the insurance. So basically, some stance, I want to use word allegedly, so I want to be in a certain situation. However, we don't know the prices. So if I don't know the prices, the only time people are forced to take these x-rays when something really bad happens. But if you like to have a prevention, we should have a transparency prices up front. So that way I know I need to go check with cardiovascular disease. I need to go to x-rays. But if I don't have the insurance itself is way too costly, like an average $1,000 per person, 2, 3, 4, 5,000 a family. An average salary in the state of Florida is $30,000 to $50,000. So basically, I have to give all of my money to insurance. So how do we do prevention when insurance and pharmaceutical company controls everything? And in some sense, they want it their way. They want to cut me at the later stage rather than the early stage. Then I become the patient for the rest of the life.
Yeah, I mean, it's just too pricey, essentially. And that's why, in my own opinion, you just have to cut out the middlemen. For example, before Obamacare was instituted, say you had a 100-bed hospital, say 25 years ago, and you had 10 administrators for that 100-bed hospital. Now you fast forward to today, you still have that 100-bed hospital, but now there's 30 administrators with giving the same services. So what does that do to the price of yours and I healthcare? I mean, it goes up. So people don't consider that. So we have to get rid of a lot of these bad regulations. And you mentioned price transparency is one of them. That's the first thing I told you. But we have to get rid of a lot of these bad regulations that are increasing the cost of care. One of the advantages of having AI, it can duplicate and do the services that a lot of these mid-level administrators do.
Correct.
There's no need. We can reduce the price of healthcare effectively using AI in a positive way.
Yes. I got a last question, and then we'll jump to the question. So you look it up on the screen and say, why should people vote for you? If you elected to the Congress, what is the one promise you are willing to be held accountable for by the voters of the Florida?
Yeah, the one promise that I can be held accountable for is I will do my best to make sure that there's price transparency for medical services and prescription drug plans. Because to me, that's the low-hanging fruit. That's the number one thing that can be done. President Trump, in his first presidency, signed an executive order to promote that. Unfortunately, it was never made a federal law.
Yeah.
So that's something that can be easily done. It's a bipartisan issue. It's not just a Republican issue. It's Republican and Democrat. So that's what I would want to get done.
Okay. So, Dr. Razack, I want to look it up directly in the screen, the red lights, and telling why should people vote for you in the District 11, candidate for Congress District 11, and besides all others, besides you are a doctor and surgeons, it's great, but what else you bringing to the table that other opponents on both sides don't do?
Yeah. So obviously I've been practicing brain surgery for 35 years in Florida. And from that, I've earned the trust of my patients and my coworkers. I also understand healthcare law. The largest employer in our district are healthcare or healthcare facilities. The number one economical problem in our district is medical bills and medical bankruptcy. That's what I understand. I understand healthcare from the inside and the outside. These policies, such as Obamacare, regulation, I teach these policies to law students. I teach these policies that I disagree with, and I understand. I know their weaknesses, and I know their positives. And because I'm a neurosurgeon, I'm the only candidate that understands this thoroughly. And I think because of that, I can best fix this problem because, as you mentioned, this is a $5.4 trillion business, and it's 22% of our economy.
And as I said, thank you, Dr. Razack, for coming here, sharing your knowledge. Guys, I want to say again, I've been in the insurance industry for 15 years. I used to be pharmaceutical rep. I was looking into this interview that has a medical degree, that has a law degree combined together. I wish we have more people in the Congress that actually understand, instead just slap the book, slap the healthcare reform, write it down, put together, pass, and then we all pay consequences. So, Doctor, I never done this before, but I want to fully endorse you for this.
Thank you.
I usually don't do full endorsements, but since you have I love the way you're discussing, I fully endorse you. and I wish you that you win this Congressional District, District 11. And please, guys, love, share. We need more. We need more doctors who come open up and talk about the freedom. You guys all talk about freedom, vaccinations, healthcare, but we need guys like this who actually understand medical, who understand the practice, who actually is between patients and the doctors, not the government candidates, not the government institutions telling you what should you do or not. So again, please help this guy out, share with others, invite others. We love you, care and share. I'm your host, Iggy. This is the podcast 74. And thank you, Doctor, for being our guest.
Thank you.
So, again, guys, please like, share. Remember one thing. It's August 19. We come to the primaries, support this guy, and I'm giving all my blessings. Doctor, thank you again. And I'm looking forward after you become in the Congress so we can come back again and tackle a couple other things. Thank you.
Anytime.
Appreciate you.
Thank you.
God bless you guys.